Hello and good evening to you. We'd like to continue our study on pharmacokinetic properties and principles. We have looked at absorption and distribution. Today we want to look at the third pharmacokinetic principle, which is metabolism. And metabolism primarily simply means a biochemical transformation. That means the drug is going to be changed from the way it entered into the body chemically, and because it's being done by the body, the biological processes, it is a biochemical transformation. So basically, when we say metabolism, in this case, we are saying the body chemically changing or altering the drug. Remember, it's a pharmacokinetic property, meaning what the body is doing to the drug. Now, why is the body transforming or chemically changing the drug? For one reason and one reason only, so that the drug, which is a foreign agent as far as the body is concerned, can be easily eliminated. The primary organ responsible for most of the metabolic processes that occur in the body is the liver. And so we will be focusing our study on the liver and its activity. But we should understand and know that the liver is not the only biochemical, the only place where these biochemical transformations occur. All right, so focus on the liver, and then we say eliminated. Elimination, we will also basically focus on the kidney. So in other words, what we are saying is that because our focus will be the kidney for elimination, then the kidney, which is only able to eliminate or remove water-soluble substances, means that the liver is going to transform a drug into a water-soluble form or a polar form so that the kidney can remove it. And that's why we say it's a transformation or an alteration for the purpose of elimination. For the purpose of elimination. All right. So, most of the time, this biochemical transformation that occurs in the liver is done by enzymes. And the enzyme, which is mostly associated with drug biochemical transformation, is the cytochrome P450 enzymes, a group of enzymes that mostly deal with drug biotransformation or drug transformation. Now, so you look at the structure here, and we are saying that this is an enzyme that is going to transform the drug. And you note that once the drug is metabolized, what will come out is called a metabolite. Therefore, we see our drug going into the liver, being worked on by the enzyme, and the drug coming out either as an active metabolite or as an inactive metabolite. Now, when we say it's an active metabolite, it simply means that that agent is able to maintain its pharmacological activity. And that activity could be similar to that of the original molecule, or it could even be better, more potent than that of the original molecule. Could even have a longer duration as well. Or when we say it's an inactive metabolite, that means that the metabolite that comes out is no longer possessing any pharmacological activity. Therefore, it is useless as far as therapy will be concerned. As far as therapy is concerned. All right. And sometimes too, the drug comes out unchanged, unaltered. Now, in this situation, it means that the liver has made its own evaluation and realized that the drug is in a form that can be easily eliminated, and hence there is no need for transformation. Okay, so other sites where metabolism could occur include the gastrointestinal mucosa, include the lungs, and even the kidney. Okay. So now we said that the metabolic reaction follows a one or more successive reaction. In this case, we are saying that the drug is going to undergo either one reaction or more than one reaction. If it's going to be more than one reaction, then it's going to go through two sessions, phase one and phase two. All right. Now, in a phase one reaction, this occurs when the drug is not having a functional group, or let's say a charge on it. That means that the drug has to be transformed into a charged form. And because of that, this is called the functionalization state or reaction. That means this reaction leads to the functionalization of the molecule, the drug molecule. It puts a charge on the drug molecule. And there are three basic processes or ways by which the body is able to achieve this functionalization. And that is either it's doing a reduction reaction, an oxidation reaction, or a hydrolysis reaction. It's either adding a negative charge, a positive charge, an oxygen or hydrogen, and it can also add water. And in the case of adding water, it's aimed at splitting the molecule. So we call when the water is used to split the molecule, so we can have two molecules with a negative and positive charge on it. We call that process hydrolysis, the use of water molecules to break a molecule into two, hydrolysis. So oxidation, reduction, and hydrolysis are the three main reactions by which a drug is transformed into a functional group. This reaction can also be called a cleavage reaction because a lot of times it is removing something so that the charge can be formed. The purpose of forming this charge is so that transformation phase two can occur. What is transformation phase two? Phase two is referred to as conjugation or coupling. In this case, it means that an endogenous molecule, which is capable of making a substance more water soluble, is added to our functional molecule or functional drug molecule that has just been formed in phase one. And some of those endogenous metabolites that are available include glucuronic acid, sulfuric acid, acetic acid, glutathione. So these are molecules that are available in circulation that can be used to conjugate the functional group that is formed. And that is why the phase two transformational reaction is referred to as the reaction of conjugation, the coupling of the drug molecule, the functional drug molecule that has just been formed with an endogenous conjugating molecule. Why is this happening? So that, like we stated, the drug can be easily eliminated. So a lot of times the transformation is turning the drug from a lipid-soluble form to a water-soluble form so that it can easily be eliminated by the kidney. So here we see the same metabolic reaction in pictures. So now we have our drug molecule. We have our drug molecule. It enters into the liver in the blood circulation. Phase one reaction, which involves oxidation, reduction, or hydrolysis, is done on the molecule. This reaction results in the drug becoming, or the molecule becoming functional, that is carrying a charge. Now, that charged molecule is conjugated with an endogenous compound. And the purpose is so the polarity or the water solubility of the agent will be increased. The increase in water solubility is what allows the agent to be removed by the kidney, And there are various endogenous molecules that can be used to accomplish this purpose. Most common of them, glucuronic acid, glutathione, sulfuric acid, methyl, and acetyl groups. All right. The same reaction we can also see here. So we have our drug, the enzyme cytochrome P450 in the liver acting on it. In this case, we see NADPH, where the H is lost, and in other words, the hydrogen is lost. And it is used in a chemical reaction or the biochemical reaction of the drug. Then the metabolite that comes out of that drug is activated for this particular example. The active metabolite in this case can be harmful to the liver. For this drug, it is harmful. So you see that the active metabolite form is injuring the liver. And a typical example will be paracetamol. After it's gone through the metabolic processes in the liver, the metabolite that comes out is an active form, and that can be injurious to the liver. Then after that, we see the conjugation stage, which is a phase 2, where another enzyme transferase adds the conjugating molecule to your agent. It's important to note that when a drug goes through the liver and it is metabolized to become an active metabolite, that drug sometimes is described as a prodrug. When we say a prodrug is a drug that usually is not active before the activation by the liver. In other words, you put the drug into the system, the drug is not active, but the moment it passes through the metabolic stage of the liver, where it is activated, it becomes an active molecule, and that can elicit the effect we are looking for. Example is a drug called heptasaline. It goes through the system and come out as the active after the metabolism. The active metabolite is ampicillin, which is what it exerts as its antibiotic properties or its antibiotic effects. Great. Now, in the situation where the drug is also inactivated after it goes through the metabolic process, in other words, where the metabolite is an inactive metabolite, it becomes important to make sure the drug is able to do whatever you want it to do therapeutically before it gets to the liver. So an example of a drug that goes through that process also is insulin. You take insulin, you inject it directly into the adipose tissues, muscles, and the purpose is so that it can help insulin achieve its aim of moving glucose. Because once insulin passes through the liver, it is inactivated. The molecule that comes out is an inactive metabolite, which will not be able to do the activity of insulin. And that's why insulin must be given IM or by the route that we use, rather than orally, where in the first situation will be destroyed by the acid in the stomach, because the protein will be denatured by the acid in the stomach. Or if it enters into the liver, it will be destroyed. All right. So here is phenytoin, a typical example of a drug. Now, phenytoin is a drug that we use in epilepsy, for example, or other psychiatric conditions. Now, phenytoin is described as a highly lipid soluble agent. So highly lipophilic, which means once inside the system, it will find it very difficult to be eliminated by the kidney. So once it gets into the liver adds a hydroxy group to the fourth carbon. So now you have 4-hydroxyphenytoin. This is a phase 1 reaction, and this phase 1 reaction results in a slightly soluble agent, an agent that is slightly soluble in water, which is the 4-hydroxyphenytoin. Then a glucuronic acid is added to this agent, and we now have 4-hydroxyphenytoin glucuronide. This addition of the glucuronic acid, which is the conjugating molecule, is the phase 2 reaction. The phase 2 reaction, therefore, results in a very soluble agent, soluble in water, and this can then be eliminated by the kidney. So now this is the purpose of the metabolism that occurs to phenytoin. Here are some factors that may affect drug metabolism. The molecular size of the drug will affect metabolism and the shape of the drug. In this case, the reaction depends, how quickly the reaction occurs may depend on the shape of the drug or the molecular size of the drug. Again, the drug's ionization, the degree of ionization may affect how the chemical reactions occur as quickly as possible. Then we can also think about lipophilic nature of the drug. The more lipid soluble it is, the more the liver has to metabolize it into a water-soluble form. The acidity, the basicity of the drug can also affect metabolism. So we are told that acidity decreases metabolism, whereas basicity increases or does not affect metabolism. Acidity decreases it drastically, but basicity does not necessarily affect metabolism significantly. So that it means if your drug is acidic in nature, then metabolism could be decreased markedly, decreased significantly. These we will call the drug factors. Then we can look at the host factors. If the primary organ that is responsible for the metabolism as we are looking at is the liver, if we have a patient with a liver problem, so chronic liver disease, this patient will have difficulty with some drug metabolisms. A patient who is also having a condition of the heart, advanced heart failure, for example, where the heart is not able to pump enough blood to the liver for the metabolic process, metabolism will be impeded. The presence of certain drugs or food may affect metabolism. Certain drugs may induce enzymes, that means cause enzymes to act quicker and faster, or may inhibit enzymes, and that means to slow down enzymes. Depending on what the drug or the food molecule is doing, other drugs that are concomitantly or given at the same time as these drugs may have their metabolism affected. That means that you have to be monitoring to ensure effectiveness and or reduce toxicity. The age of a patient may also affect the metabolism of the drugs. The elderly usually have a reduced metabolic capacity. Babies also have a reduced metabolic capacity compared to the young adults. And so that can be a reason. Genetics. A person's genetics can be a reason for different metabolisms. For example, we know people who have fast metabolism, and we have those who have slow metabolism. So these things are dependent on their genetics, and the genetics also affect it. It's as a result of the enzymatic activity. So people whose genetics predisposes them to higher enzyme activity or have more metabolism compared to individuals who have slower enzymatic activity. Hormones may also do the same, increase enzymatic activity or decrease enzymatic activity. Gender, because of the difference in the hormone system, can also affect enzymatic activity. All right. So various factors that could affect our metabolism. Always remember that when we are looking at these factors, be conscious of where in the pharmacokinetic process we are looking at, because the factors are quite similar and they are the same at various points. So you just have to be cautious at which point you are making your reference to so that you do not make simple errors as you try to explain these things. Thank you very much. I hope this helps you, and please subscribe to the channel as we continue to study together. The Lord bless you, keep you, cause his face to shine over you. Till we meet again, have a wonderful, wonderful rest of the day. God bless.